ಊಟದಲ್ಲಿ ವಿಷ ಬೆರೆಸಿದ್ದೀರಿ. ನಾನು ತಿನ್ನಲ್ಲ.
ತಮಿಳ್, ನನ್ನ ಮಾತು ಕೇಳು.
ಅವರಿಬ್ರು ನನ್ನ ಬಗ್ಗೆನೇ ತಪ್ಪಾಗಿ ಮಾತಾಡ್ತಿದ್ದಾರೆ.
ಇಲ್ಲಪ್ಪ, ಹಾಗೇನಿಲ್ಲ.
ಇಲ್ಲ, ನನ್ಗೆ ಚೆನ್ನಾಗಿ ಗೊತ್ತು ಅವ್ರು ನನ್ನ ಬಗ್ಗೆನೇ ತಪ್ಪಾಗಿ ಮಾತಾಡ್ತಿರೋದು.
ಓಕೆ, ಸೊ ನೀವು ಇವಾಗ ಏನು ನೋಡಿದ್ರಿ ಅಂತಂದರೆ ಸೈನ್ಸ್ ಆ್ಯಂಡ್ ಸಿಮ್ಟಮ್ಸ್ ಆಫ್ schizophrenia. Okay, so you saw some signs and symptoms of schizophrenia, so who made by the Dr. Pradeep Veluswamy. Okay, Dr. Pradeep Veluswamy YouTube channel. So now we will see only for academic purposes we will see what are all the signs and symptoms of schizophrenia and what will be the definition and what are the etiological factors for this condition. Okay, so we will see all those things. Hi, this is Mr. Khalil from KN Education YouTube channel. Right, so schizophrenia. In the schizophrenia, if you split the two words, you will get the schiz and phrenia. Schiz means that is splitting. Okay, schiz means what? That is splitting. Phrenia means that is mind. The splitting mind is called schizophrenia, or you can call it as a split personality. What do you call? Split personality, right? So as I mentioned here, it is a psychotic disorder. What I said? It's a psychotic disorder. So it is a psychotic disorder. A schizophrenia is a psychotic disorder which is having some tab disturbance. Tab disturbance means that is thought. There is a thinking problem. They have some problems of thinking someone is poisoning him, or someone is broadcasting his thoughts, and someone is inserting his thoughts. Everything we will in detail we will think, we will discuss in this video. So this is and this is the thought affect what the mood they have and what type of the behavior they are showing in front of the people or in front of the psychiatrist. Okay, so in the presence of a clear in the presence of the consciousness, and this insight will be not there. In the clear presence of the consciousness, which usually leads to social withdrawal. Okay, so ಅವರು ಏನು ಮಾಡ್ತಾರೆ, isolate. They will be isolated always because they will think someone wants to kill him, or someone wants to make him down, or they are not getting the respect, so that they will feel always, and they will listen some loud voices of his own thoughts. Okay, so that's why because of this fear he will be always out of the people because they may kill him. So that type of thought will be there in this type of patients, right? So that's why they are getting the social withdrawal. They will be isolated. They will be separate in their room, or separate in their couch. Okay, so that's what the definition is saying in the schizophrenia topic. Okay, so we will move to the next, that is etiology. Before moving to the etiology, first and foremost you have to understand where the schizophrenia comes from, right? The schizophrenia we have in the psychiatric disorder, we have some two types. First one is organic brain disorder, and another one is non-organic or inorganic brain disorder. So non-organic brain disorder means here there is a functional problem. Okay, what it is there? Here there is a functional problem, and here there is a problem in brain itself. Okay, there is a problem in the brain parenchyma. That means most of the old ages, so if they got anything like more than 45 years, you can say more than 45 years of old people, they may have organic brain disorders like delirium and dementia. But in the non-organic or inorganic or functional or psychosis will comes under, that means schizophrenia comes under this non-organic and this one. Okay, that is schizophrenia. OCD will comes, depression will comes. Okay, these are all non-organic, or you can say that is functional disorder. That means they are having well oriented, actually they know where they are, what was the time it is, and who is the person is in front of him, whether it is father or his mother, or whether it is their place, whether it is their destination, or whether it is hospital or the mall, what it is, what the place it is. The time, place, person is actually the well oriented. That means they have well consciousness. To the non-organic, that is functional. But when it comes to the organic, here it is not a well oriented, there is a disorganized. There is a, they can't understand where they are. There is a confusion, mental confusion, we can say mental confusion. They have a mental confusion. So they don't know the TPP, they don't know where that, what was the time and who is the person and what was the place it is. Who are you and why I am here and what was the time and why this time I am here. So they can't understand that, what we call it as organic mental disorder. Usually that will be seen in the delirium and dementia, right? So actually it is acute, it can be severe at a time in a short period of time. When it comes to the non-organic, it will be never be fast. That means it will take too lengthy process. It's a too lengthy process. Are you getting what I am saying? It takes the non-organic or functional, it will takes from several years to the decades, from 1 year or 2 year, from up to, that is 10 years or 20 years. It will takes up to the lengthy process for the severity. Okay, so the non-organic have the severity level is very lengthy, and for the severity level of the organic is very little period of time itself, that will they may get severity, that is acute. Are you understood about the acute and chronic? Acute is brain, acute is organic brain disorder, and chronic illness is non-organic brain disorder. I hope you understood this one. Okay, so in the non-organic itself, in the non-organic or inorganic you can say, or functional you can say, we have categorized into psychosis and neurosis. Psychosis and neurosis. Okay, psychosis and neurosis, that means here they know what they are actually doing. So whether that means they know ಅವ್ರಿಗೆ ಗೊತ್ತು ಏನು ಮಾಡ್ತಾ ಇದ್ದಾರೆ ಅಂತ. That means OCD you can say, or you can take the depressed patients. Okay, so they know what they are doing. They are taking the key of the bike again and again, and they are forgetting the bike key again and again, or they are forgetting the home key, whatever the thing is they are doing again and again. The compulsion, obsessive and compulsion disorder is there, but they can understand, yes, why I am doing this again and again. There is a presence of an insight. And in the depressed people, they will say, I am depressed, man, please leave alone, I will talk afterwards, right? So they know they are depressed, they know their mental illness, they know what actually the affecting thing it is, right? So if they know, that is, if they know about their mental illness, that's what we call it as insight. Okay, insight is present in the neurosis, insight is absent in the psychosis. If anyone say, so I know everything, and does anyone, if he disagrees about his whatever thing he know, if anyone disagrees his words, that time he will say, no, you don't know anything, actually I know. So I am the one who person, I know everything. If they say like that, they are having the delusion of grandiosity. Delusion of grandiosity they have. ಏನಿದೆ ಅವರಿಗೆ, ನನ್ನಷ್ಟು ಯಾರು ಬುದ್ಧಿವಂತರಿಲ್ಲ, ಅಥವಾ ನನಗಿಂತ ಶ್ರೀಮಂತರು ಯಾರು ಇಲ್ಲ. ಸೊ ಇಫ್ ದೇ ಥಿಂಕಿಂಗ್ ಲೈಕ್ ದಟ್ ಇನ್ ಅ ಸುಪೀರಿಯರ್ ಲೆವೆಲ್ ಫಾರ್ ದೆಮ್ಸೆಲ್ಸ್, ದಟ್ಸ್ ವಾಟ್ ಯು ಕಾಲ್ಡ್ as psychosis. Okay, sorry, that's what you called as grandiosity, delusion of grandiosity. The delusion of grandiosity is present in the psychosis, and the delusion of grandiosity is not present in the neurosis. Okay, the delusion and the hallucination. Delusion and the hallucination is present in the psychosis, and delusion and hallucination is absent in neurosis. Are you getting? That means in the organic there is a presence of visual hallucination, in the non-organic there is a presence of auditory hallucination. That means here there is a presence of auditory hallucination normally. Okay, here there is no hallucination, there is a absence of hallucination and delusion. In the neurosis there is no hallucination and delusion. I hope you understood this one. In the schizophrenia, delusion of grandiosity may be there, it will be there, and delusion of persecution is the most common. Okay, and auditory hallucination is the most common. The most common hallucination of the schizophrenia is the auditory hallucination. The most common delusion of the schizophrenia is delusion of persecution. So someone wants to kill him, or someone has to chase him, the police is always chasing him, or someone have some CCTV and they are watching. So that is nothing but what they are thinking something, and they are having thought disorder. That thought disorder is nothing but the delusion of persecution they have. Okay, so the psychosis in psychotic disorder, schizophrenia is a psychotic disorder which it is having the tab disturbances in the clear consciousness. That means that is non-organic psychotic, right? Okay, so in the organic there is no clear consciousness, there is a cloudy consciousness, or there is a mental confusion, right? Okay, next etiology. When we come to the etiology, in the etiology we will see the most of the dizygotes and monozygotes. That monozygotics have this type of schizophrenia more than the dizygotes, and there is a, for the genetic explanation, there is an increased level of dopamine and serotonin. So serotonin and dopamine, the dopamine which will responsible for the pleasure or reward, you can say pleasure, reward. Okay, so the serotonin, so good mood, good food, good sleep. So if they have that, that is because of the serotonin. Here the actually the dopamine and serotonin is very less. Actually the dopamine will be very increased, sorry, not less, it will be very increased in the level of the dopamine. Okay, so as per the research, the prefrontal limbic cortex was underdeveloped. Here you are confusing now because it is comes under organic or it is comes under inorganic. So in the inorganic there is no changes in the parenchyma. Actually what I said, there is no changes in parenchyma, but it is not at all developed, underdeveloped. After the development, if there is a changes, then that is what you call, there is a organic, but it is underdeveloped, right? So the, as per the research, the prefrontal cortex and limbic cortex was underdeveloped. That's why there is a problem in what, there is a increased what, there is a problem in the mental illness, there is a mental illness, that is schizophrenia, right? So increased size in the sulci means there is a space, right? The space of the brain, this area is very increased, the size is increased, okay, on the surface of the brain. So the sulci has been increased, the size of the increase in size in sulci on the surface of brain. Okay, most commonly we will see in the winter season. Okay, winter season for the pregnant lady, for the pregnant during delivery, it's having the chances of getting schizophrenic. Okay, cannabis, using of cannabis, LSD, cocaine, alcoholic patients also may have this type of mental illness, that is schizophrenia ಇವ್ರಿಗೂ ಬರುತ್ತೆ. ಓಕೆನಾ. ನೆಕ್ಸ್ಟ್, what are the 4A symptoms of Eugen Bleuler? See, Eugen Bleuler ಏನು ಮಾಡ್ದ, Eugen Bleuler given the 4A symptoms, that is socially isolated autism, association disturbances, that means you can say association looseness, and ambivalence, unable to give the decision, perfect decision, unable to make the perfect decision, will call it as ambivalence. And affect disturbance, they have one time they may have the anger, one time they may have shouting, and one time they may laugh. So there is a changing in the affect changes. So that's what label affect will call label affect or affect. Look for that. Okay, so label affect or affect, it will be there. So change in the this one mood, change in the mood, one time they may be higher emotions, and one time they may have lower emotions, and one time they may shout at to anybody. So that's what there is a not proper matching, the mood is not proper matching according to the situation. So that's what we call affective disturbances. Association disturbance is there, associative looseness, that means they can't able to mingle with, okay, they can't able to associate with others. So that is nothing but associate disturbance. They want to be the association disturbance is comes under the delusions. Okay, that is flight of ideas will be there, and formal thought disorders. I think you heard this one. Formal thought disorders, ಫ್ಲೈಟ್ ಆಫ್ ಐಡಿಯಾಸ್, ಏನೋ ಒಂದು ಹೇಳ್ತಾ ಇರ್ತಾರೆ, ಅಂದರೆ ನಾವು ಯಾವುದೋ ಒಂದು ಕ್ವಶನ್ ಕೇಳಿದಾಗ, ವೆನ್ ಎವರ್ ದ ಸೈಕ್ಯಾಟ್ರಿಸ್ಟ್ ಆಸ್ಕ್ ದ ಕ್ವಶನ್, ದಟ್ ಟೈಮ್ ದೇ ಮೇ ಗಿವ್ ಸಮ್ ಆನ್ಸರ್ಸ್, ಬಟ್ it is not at all relevant to the question, and they will come to the point. So that's what we call it as circumstantiality. So whenever the patient is giving unnecessary answers to the question, which is not at all relevant to the unnecessarily giving some answers which is not at all relevant to the question. So whenever the patient is giving the unnecessary answers to the question, okay, it is not at all relevant to the question. So that type of will be called as tangentiality. Okay, if they are coming to the answer finally, that is circumstantiality. Okay, so ಕೊಂಕಣ ಸುತ್ತಿ ಮೈಲಾರಕ್ಕೆ ಬರೋದು ಅಂತಂತಾರಲ್ಲ. ಓಕೆ, ಸೊ ಗಣೇಶನ ಊರು ತುಂಬ ತಿರುಗಿ ಏನು ಮಾಡ್ತಾರೆ, ಮೈಲಾರಕ್ಕೆ ಕರ್ಕೊಂಡು ಹೋಗ್ತಾರೆ. ಬಟ್ ಆ್ಯಕ್ಚುಲಿ ಏನಾಗಿದೆ, ಅಲ್ಲಿ ದಾರಿ ಹತ್ರನೇ ಇರುತ್ತೆ, ಬಟ್ ಆ ಹತ್ರದ ದಾರಿಯಿಂದ ಹೋಗೋ ಬದಲು ಸುತ್ತಾಡ್ಕೊಂಡು ಹೋಗ್ತಾರೆ. ಸೊ ಅದೇ ರೀತಿ ಅನ್ನೆಸೆಸರಿ ಆನ್ಸರ್ಸ್ನ ಕೊಡ್ತಾ ಹೋಗ್ತಾರೆ, ಬಟ್ ಮೇನ್ ಪಾಯಿಂಟ್ಗೆ ಅವರು ಬಂದೇ ಬರ್ತಾರೆ. ಸೊ ದಟ್ ಈಸ್ ನಥಿಂಗ್ ಬಟ್ ಸರ್ಕಮ್ಸ್ಟ್ಯಾನ್ಷಿಯಾಲಿಟಿ. ಟ್ಯಾಂಜೆನ್ಷಿಯಾಲಿಟಿ ಅಂದರೆ ಅವರು ಅನ್ನೆಸೆಸರಿ ಆನ್ಸರ್ಸ್ ಹೇಳ್ತಾನೆ ಇರ್ತಾರೆ, ಯಾವುದೇ ಕಾರಣಕ್ಕೂ ಅವ್ರು ಮೇನ್ ಆನ್ಸರ್ಗೆ ಬರೋದಿಲ್ಲ. ಸೊ ದಟ್ ಈಸ್ ನಥಿಂಗ್ ಬಟ್ ಟ್ಯಾಂಜೆನ್ಷಿಯಾಲಿಟಿ. ಸೊ ದಿಸ್ ವಿಲ್ ಬಿ ಸೀನ್ ಇನ್ ಅಸೋಸಿಯೇಟ್, ಒಂದಕ್ಕೊಂದು ಸಂಬಂಧ ಇರ್ದಿಲ್ತಕ್ಕಂಥದ್ದು. ಲೂಸ್ನೆಸ್, ದೇ ಡಿಡೆಂಟ್ ಕ್ಯಾಚ್ ದ ಕ್ವೆಶ್ಚನ್ ಆ್ಯಕ್ಚುಲಿ. ಸೊ ದೇ ಆರ್ ಹ್ಯಾವಿಂಗ್ ಸಮ್ ಲೂಸ್ನೆಸ್ in their ideas. So that's what we call associate disturbance. So socially isolated, they don't want to togetherness, they don't want to be with others, or they don't want the friendship, and they don't want to mingle with others. Always they will stay in the dark room. Okay, so they want to be alone because some of them will kill him, like that. So that's what the autism is. In the schizophrenia, these 4A symptoms is present. Okay, so as said by the Eugen Bleuler, always remember the first word schizophrenia coined by, that is Eugen Bleuler. But the first this one schizophrenia was explained by another one, that is Emil Kaplan. It will be there, but actually is the whatever the symptoms he said, it is correct, but the name what he has given, that is not correct. He given for the schizophrenia, previous name is dementia precox. Actually this dementia precox is related to only young. Okay, are you getting? It is only related to the young. Precox, that means adolescent. So here the schizophrenia is occurrence only for the adolescent. That was the explanation of it. Okay, but actually some of the cases also have the schizophrenia after the 45 of years. it will be seen more than 45 years of age. That's why, so this dementia precox is not at all maintain the name for schizophrenia. So the next coining of the schizophrenia is done by Eugen Bleuler. Okay, so the name was given, the coining of the this one name will be by the Eugen Bleuler. Okay, so next we will see the next one, that is Snyder's. Okay, Kurt Snyder's first rank symptoms of schizophrenia. So what are the first rank symptoms of schizophrenia? We will see as per said by the Kurt Snyder. Okay, so auditory hallucination, they may listen some voices. Okay, so they may listen some voices which is out of the body. Okay, not inside the body. If they are listening inside the body, if they are listening some auditory hallucination inside the body, that may not be the real hallucination, that will be said as pseudo hallucination. Okay, so there are special types of hallucinations are there, which is not at all important now, but inside the body some blood flow, I am listening some blood flow, or someone is talking in my mind. Okay, so if they are listening their activities inside, so that is nothing but pseudo hallucination, that is not a true hallucination, right? So auditory hallucination means which is outside the body or outside the wall. So if they are listening any commands, or if their own thoughts itself they are listening loudly, so that one will quote as thought echo. What you call thought echo. Okay, if they are listening their own thoughts, whatever they are thinking. Okay, so that will be listened, that will be heard very loudly. So that is nothing but thought echo. So the auditory hallucination in the form of statement, so that will order that. So you have to stop walking here and there. Okay, so go to the third floor, go to the fourth floor. So it will give the statement, and if I want to go for can I go to second floor, it will give the reply, no, you have to go for third floor. So that is nothing but the reply, it will give the statements and replies, the auditory hallucination. Next, hallucinatory voices in the form of running commentary. Running commentary means what? Here it will never tell only one times, it will tells go to the third floor, go to the third floor, go to the third floor. So it will says the running commentary, and it will again and again it will says. So that's what the hallucinatory voice is, running commentary. And not like that, not only that, so the running commentary also like, so it will links one to one. If you go to the college, so the teachers will kill you, or the friends will kill you, or they may talk with you with your bad words, and what you will do at that time. Okay, so don't go, like that it will gives the running commentary, it will never stops. That's what you call running is. That is first one, auditory hallucination. What it is? Auditory hallucination. We'll go to the second one, that is thought disorder. In the thought disorder, what it is there? Thought withdrawal. Okay, thought withdrawal. Here what the patient will think, someone is taking my ideas. Okay, someone is taking my ideas. So stealing of ideas. Someone is stealing his ideas. And thought broadcasting, and after that they will publish in the media, or they will forecast in the TV, newspaper. Okay, in the troll. Okay, so they are thinking the thought broadcasting. And next one is thought insertion. It is stealing of ideas by, like you can say, that is memory chips. Someone has inserted the memory chips inside his brain. So whenever their parents or whenever their guardian says, yes, we have to meet the psychiatrist, means that time they will say, okay, so the auditory hallucination will say that you should not go to the psychiatrist. So thereby the thought withdrawal. Why? Because they will think now, not auditory hallucination, now the thought disorder we are seeing. So the thought disorder. First thing is auditory hallucination is commanding. Okay, are you getting? Auditory hallucination means it is commanding. Okay, but the thought disorder means here is only the patient only thinking wrongly. Okay, thought withdrawal. If I go there, they will insert some memory chips and they will withdraw my ideas. Okay, so that is thought withdrawal, right? So thought broadcasting means the media, TV and newspaper troll pages, they will broadcasting my overall thoughts, whatever I am thinking. So that is thought broadcasting. Thought insertion. I hope you understood this thought disorder. Okay, we'll move on to the made disorder. Now the patient is thinking, okay, all right, it has finished. Auditory hallucination finished. This is thought disorder is finished. Now we will see the made disorder. Made disorder means action. There that time they are only thinking, now it is in action. So the made act, so that means they will harm others, or they may violate others, or they may talk bad words, because that is commanded by others, commanded by someone which is having the auditory hallucination, right? So bad words. And so that act, if they are enacting as per the auditory, so they are, the thing is acting, not only they are listening, they are also acting now. So that is made disorder, right? So made affect their emotions also. Sometimes it is different. Always remember the mood and affect is both are same. Okay, mood or affect both are same, only the difference is mood is lengthy, longer period of time, affect is short period of time, that's it, right? Affect disturbance, or you can say mood disturbance, mood disorders, both are same, but affect is short, mood is longer. Okay, so the made feelings means you can say made impulse. That means if a psychiatrist is sitting in front of the patient and with a cup of coffee or with some knife, you can say knife, is holding, if actually we should not take, that means psychiatrist should not take as, or psychiatric nurse should not put any knives or sharpened objects in front of the or in the room of the patient, because they are tendency to have a suicide or homicide. ನಿಮ್ಮನ್ನು ಸಾಯಿಸ್ಬೋದಿಲ್ಲ, ಅವರೇ ಸಾಯ್ಬೋದು. homicide, they can suicide, they can die themselves, or they can kill others. Homicide means kill others, themselves they are dying with some impulses, that is suicide. Now the impulse is, whenever you are as a psychiatric nurse or as a psychiatrist, they are interviewing, or they are asking some questions to the patient. That time if they do some impulse, like if they slap or if they grabs anything of the psychiatrist, like shirt or the pen from the, or some iPads, okay, some iPads if they grab, so that time what happens here, they are grabbing, or they are the impulse is not done by him, the patient impulse is not, he is explaining, patient is explaining, now the impulse, it is not done by me, someone is controlling me and they are doing these things, I am not the person is doing, someone is making me to do these things. So that is made impulse. Are you understanding? ಯಾರೋ ನನಗೆ ಹೇಳ್ತಾ ಇದ್ದಾರೆ, ಆದ್ದರಿಂದ ಯಾರೋ ನನಗೆ ಮಾಡಿಸ್ತಾ ಇದ್ದಾರೆ, ನಾನಾಗೆ ಮಾಡ್ತಾ ಇಲ್ಲ, ಇದನ್ನು ಏನಂತ ಹೇಳ್ತಾರೆ? ಸೊ ದಿಸ್ ಈಸ್ ನಥಿಂಗ್ ಬಟ್ ಮೇಡ್ ಇಂಪಲ್ಸ್. ಆರ್ ಯು ಅಂಡರ್ಸ್ಟುಡ್? ಮೇಡ್ ಇಂಪಲ್ಸ್, ದಟ್ ಮೀನ್ಸ್ IPC section 84 ಪ್ರಕಾರ. ಸೊ if any psychiatrist talking with the patient, that time if the patient is killing to the doctor, means that time also there is no jail, or there is no problem to the patient, the problem for only the psychiatrist. That's why So there is no case for the patient one who have the schizophrenia. Are you getting? So that's why you should not have some any sharpened objects and other things in front of the patient, whether it is psychiatric nurse or whether it is psychiatrist. Okay. Next first rank symptoms we can say FRS, that is somatic passivity. That means they are having some pain or they may have they are having some pain. Okay, they are having some pain or they may feel some I can give some example, that is okay. So if any the favorite, now it is election time, you can say the election. So the favorite leader, if their favorite leader was not elected as a minister, that time they will feel like they are getting heart attack. Okay, so that is normal actually, but that time they don't have any causes, still they are getting pain. That means they will say they are thinking about the favorite, or I can say that is some radiation signals are infrared signals are sending from out of the space, and that is making him abdominal pain. So they have some visceral problem, they have some visceral pain inside the body, and that is not because of the inside of body, the cause is not because of the body or because of the their mistakes, because of someone else. Okay, because of someone else they are getting pain. That means they didn't touch and they didn't made anything, so that is nothing but visceral hallucination. Okay, so next, delusion with normal. So delusion with normal will call as delusional persecution, delusion of persecution. Here what happens, by seeing I can give you that example. There is a if any police, if you saw any police, that time you will behave like the schizophrenic people will behave like they are robbers. Patients themselves, they behave like they are robbers. Okay, they are thieves, you can say thieves. Okay, they are thieves, and they will escape from them because the police is nearby in front of him. Okay, so they feel like they are committing some crime, they are committed some crime. So themselves they are committing some crime, that wrong perception, whatever the wrong thoughts they have, not perception, wrong thoughts they have. So that is nothing but the delusion. Okay, not the perception, wrong perception. The disorder of perception is nothing but hallucination. Wrong thoughts, false thoughts or disorder in the thoughts will call it as delusion, right? So by seeing the police, they will think they are themselves as a thieves, even though they are the innocent. Okay, that is nothing but delusion persecution. Okay, that is nothing but delusion of persecution. Here somatic passivity means someone is making wrongly ಮಾಟ ಮಂತ್ರ ಮಾಡಿಸಿದ್ದಾರೆ, ಅದಕ್ಕೆ ಈ ಥರ ಆಗ್ತಾ ಇದೆ. ಓಕೆ, ಯಾರೋ ನಮಗೆ ಆಗದಿರೋರು ಏನೋ ಹಾಕ್ಕೊಟ್ಟಿದ್ದಾರೆ, ಊಟದಲ್ಲಿ ಏನೋ ಹಾಕ್ತಿದ್ದಾರೆ, ಸೊ ಅದಕ್ಕೆ ನಮಗೆ ಹೊಟ್ಟೆ ನೋವಾಗ್ತಾ ಇದೆ, ಈ ಥರ ಅನ್ನೋದನ್ನ ನಾವೇನಂತೇವೆ ವಿಜುವಲ್ ಹ್ಯಾಲುಸಿನೇಷನ್. ವಿಲ್ ಥಿಂಕ್ ದಟ್ ಈಸ್ ವಿಜುವಲ್ ಹ್ಯಾಲುಸಿನೇಷನ್. ಓಕೆ, ನೆಕ್ಸ್ಟ್, ಸೊ ಟ್ರೈ ಟು ಆನ್ಸರ್ ದಿಸ್ ಒನ್. Who coined the term schizophrenia? That is, who coined the term schizophrenia? The Enthoven William, that is ECG, electrocardiogram ಕಂಡುಹಿಡಿದಿದ್ಯಾರು? Enthoven William. ಸ್ನೀಡರ್, that is first rank symptoms, ಇವಾಗಿನ ಓದಿದ್ವಿ. ಸ್ನೀಡರ್, ಕುರ್ಟ್ ಸ್ನೀಡರ್, that is first rank symptoms. ಓಕೆ, ನೆಕ್ಸ್ಟ್ ಕಾರ್ಲ್ ಕಾರ್ಬಮ್ಸ್, ಇವ್ರು ಏನು ಮಾಡಿದರು? ಮೋಟಾರ್ ಸಿಂಪ್ಟಮ್ಸು ಸಿಜೋಫ್ರೇನಿಯಾದಲ್ಲಿ ಬರುತ್ತೆ. ಓಕೆ, FRS ಬರುತ್ತೆ, ECG ವಿಜುವಲ್ ಹ್ಯಾಲುಸಿನೇಷನ್, ಹಾರ್ಟ್ ಭಾಳ ನೋವಾಗ್ತಾ ಇದೆ ಅಂಥ ಟೈಮಲ್ಲಿ ECG ಮಾಡಿದರೆ. ಎಂಥೋವೆನ್ ವಿಲಿಯಮ್. ಓಕೆ, ಸೊ ಡ್ಯೂ ಟು ಸಮ್ ವಿಷರಲ್, ವಾಟ್ ಎವರ್ ದ ವಿಷರಾ, ಪ್ಲೂರಾ, ಓಕೆ, ಪ್ಲೂರಲ್, ವಿಷರಲ್, ಆರ್ ಯು ಗೆಟಿಂಗ್ ವಿಷರಲ್ ಇನ್ಸೈಡ್ that means the internal organs are getting pain, right? So abdominal pain, heart, if they are getting pain. So car bumps means motor symptoms, catatonia, muscle pain, or if they steady, if they are not moving at all, so that motor symptoms, stuporness also we can call, but the motor symptoms, the catatonia is given by the Carl bumps. Okay, Carl bumps. Are you getting? Eugen Bleuler coined the schizophrenia. The answer is Eugen Bleuler. What the answer is? Eugen Bleuler. Right? So we'll move on to the next one, that is positive symptoms. What are the positive symptoms in schizophrenia? That is delusion of grandiosity will be there. Okay, so I am the superior. Delusion of persecution. Okay, delusion of persecution will be there. And bizarre, that means they will feel, yes, always I am the wrong. Okay, so nande tappu bidrappa, nande bidu, nande tappu bidu, athara. So if they are behaving like some magical thinking, if they have, so that's what we call it as bizarre behavior. Okay, excitement of the manic activity and auditory hallucination, these are the positive symptoms. Actually the positive symptoms means what, right? The positive symptoms means before the schizophrenic disease, illness, before the schizophrenic illness, it was not present, the grandiosity is not present, he feels innocent, himself is saying that I am very low. Okay, and himself he is saying no one is against me, everyone is my friends. Okay, so they are only saying they are my friends before, but after the getting disease condition, everyone is enemy for him. So someone is talking about himself, so someone is talking about him, sorry, that means whatever the acts of him. Okay, that is nothing but the thoughts, delusion of persecution. Okay, next bizarre behavior, excitement, these are all not present before the schizophrenia. After the schizophrenia, that means after occurrence of mental illness due to some etiological factors. Okay, as we said, the genetic factor, dopamine increased dopamine. Okay, so these things what they will do, that will act positive symptoms. Are you getting? If anything is add on after getting schizophrenia, so that is nothing but positive symptoms. If any symptoms means whatever we saw, we can observe, sorry, whatever the subjective feelings of the patient is there, so whatever the subjective feeling of patient is there, that's what we call symptom. Signs means we can saw, right? SIGN, sign means we can observe, symptom means we can access the information, we can assess the information from the patient through the subjective inner feeling, what they are feeling. I am the superior one, grandiosity. What you are feeling, if someone wants to kill me, that is persecution. Excitement of maniac activity, they are exciting, euphoric, and so here euphoric and dysphoric will be there. Euphoric is always be higher in the excitement, and dysphoric is also comes under in the which one, hypermania itself, but dysphoric means what, irritable, they are irritate with the mania. Okay, irritate with the mania, that's what we call it as dysphoric, euphoric. Okay, next auditory hallucination will be there. These are the positive symptoms. Next we will move on to the negative symptoms. Negative symptoms means before the schizophrenia, this is schizophrenia, this is before, this is after. Before the schizophrenia, these things are present, that means things are present, but now it is absent. What are all the absent things, we will see. First, they have a ability to express the pleasure, they have ability to express the pleasure. ನೀನು ಫಸ್ಟ್ ರ್ಯಾಂಕ್ ಬಂದಿದೆಯಾ, ನೀನು ಯೂನಿವರ್ಸಿಟಿ ಟಾಪ್, ಅವಾಗೆಲ್ಲ ಏನಾಗ್ತಾ ಇತ್ತು, ದೇ ಆರ್ ಗೆಟಿಂಗ್ ಸಮ್ ಪ್ಲೆಷರ್. Okay, they are getting some pleasure, but now after schizophrenia they are not getting any pleasure. So that's what we call it as inability to have the pleasure will be called it as, that is inability to have the pleasure will be called anhedonia. Inability to express the pleasure will be called anhedonia. Okay, next evaluation. Evaluation means they have some motivation before, they have motivation, if yes I have to do this work, surely I will get this one, surely I will do it, I can do it. So that's what it is present before, but after schizophrenia this evaluation gone lost. Okay. Next, asociality, that means first they will mingle with others, they are mingle with others, but now they can't mingle with others, they want to be isolate, they want to be separate. Okay, they want to be single always. Single means not that single, single means they don't want to talk even with their mother, with their father, with their relatives, with their sister, with their brother, everything. That is nothing but asociality. What it is? Asociality, right? So alogia, unable to speak, unable to speak. Aphasia, okay, so they can't able to speak, can't able to speak. Label effect, label effect means they have a changes in emotions, so one time they may laugh and one time they may have this one, what, and the affect they have disorder. Affect always changes, not like morning and evening, always at a sudden. Okay, so now someone is talking with a laugh and all of a sudden he is crying, so that's a label effect. Okay. Next, we will move to the next one, that is schizophrenia has hallucination, delusion, disorganized behavior, formal thought disorder, so like wearing the multiple shirts, wearing the multiple this one, like multiple pants, wearing some the things which is not related to the human, which is not related to the which is not related to the clothes. Okay, that type of like wearing the plants and other you saw in reels, right? So that is disorganized behavior, right? Formal thought disorder. Are you getting? If they don't wear anything, that is also formal thought disorder, disorganized behavior itself, disorganized personality. So if they are naked themselves, that is also disorganized behavior. Okay. So next one is, that is we can see, that is the motor symptoms, catatonia, negative symptoms, as we already saw that one. So any three of them, listen here carefully, any three of them, okay, is there any two, okay, any two for 6 months, if it is there, so this is confirmed there is a presence of schizophrenia according to the DSM-5. This is according to the DSM-5, but according to the ICD-11, why we have to wait for up to 6 months? We can consider in 1 month itself. Okay, in 1 month, up to 1 month, if they have 2 symptoms, that what we call it as schizophrenia. But if you say before 1 month, if you ask me before 1 month if these symptoms are there, and after 1 month, after near to the 1 month, there is no this type of presence of symptoms is not there, there is absence of symptoms, that is acute, that is not schizophrenia, that is acute psychotic disorder. What it is? Acute psychotic disorder. Are you getting? Okay. Next. Okay, so we have saw many things in that. We saw, firstly we saw that is definition and how this schizophrenia comes from, and we saw what are all the etiological factors, and we saw some FRS, the Snyder's FRS, first rank symptoms, and lastly we saw that there is a presence of what? Positive symptoms and negative symptoms. So positive symptoms and negative symptoms, it is based on the WHO. Okay, based on the WHO, it is positive symptoms and negative symptoms. Based on the Snyder's, that is different symptoms. Okay, and etiological factors as I explained already, right? And the definition: affect, thought, behavior. If there is a disturbance and psychotic disorder, it is schizophrenia. And there is a etiological factor, some season in the winter, and they are getting some what? Increased in dopamine, or prefrontal and limbic system is underdeveloped. That type will call, that is a causes or etiological factors. Next, signs and symptoms. If you come in the signs and symptoms in the Snyder's, you will saw there is a presence of what? Auditory hallucination. Next you saw there is a thought disorder. Next you saw there is a presence of maid disorders. Next you saw that is there is a passivity, sensory passivity, and another one is that is delusion persecution. That is about the what, that is all about the signs and symptoms. Next you saw this, after the sneezers you saw the positive symptoms and negative symptoms. What are the positive things, symptoms which is not at all present before, but it is add on after the schizophrenia, after the illness, that is positive symptoms. What are all the things that is not at all what are all the symptoms that is present before but it is not present now, that is negative symptoms. The thing is, if that is add on, that is positive symptoms. If they not present as like before, that is negative symptoms. I hope you understood this one. We will see the this one, what are all the types of the schizophrenia and what are the management of the schizophrenia in next class, in next video. And if you want to see the research video, of the purposes and according to the question bank itself I have done, so you click on this one, you will get what, you will get that playlist and you will get that video. Okay, I hope you understood. Thank you for watching this video.